Okay, it is called 4:15 on November 28th, 2023. This is the Board of Directors special meeting, Trophy Club Municipal Utility District Number 1. Again, it's 4:15, and we do have a quorum. We have Secretary Treasurer Doug Harper calling in, and Emily, you can hear us, is that correct? Okay, our attorney is also calling in. Okay, we're calling to order again at 4:15. Citizens' comments. This is an opportunity for the citizens to address the board on any matter, whether or not it is posted on the agenda. The board is not permitted to take action on or discuss any comments made to the board at this time concerning an item not listed on the agenda. The board will hear comments on specific agenda items prior to the board addressing those items. You may speak up to 4 minutes or the time limit determined by the president or presiding officer. To speak during this item, you must complete the speaker's form, these blue forms right here, that includes the topics of your statement. Citizens' comments should be limited to matters over which the board has authority. We have a full room. Lori, we have any speakers?
No, sir.
Okay, thank you. Okay, moving on, regular session. Discuss and possible action regarding employee health and ancillary benefits for the calendar year beginning January 1st, 2024 and ending December 31st, 2024, and authorize the general manager to execute the necessary documents to implement the board action. This was on the last agenda and it did not pass, so it was moved to this agenda. So Vice President Brewster could ask any questions he had, and our staff members have presented some good information. Alan, do you want to go over anything, or Steven?
Well, I guess my question for you is there any additional questions you have based off of the summaries that we provided? Late today, we provided you a benefit selection using the proposed FY 2024 healthcare cost numbers and using the employee selections from last fiscal year's open enrollment. So that way you could see generally how many employees were selected in different plans. We also provided you the same summary of medical expenses, and overall between health, dental, and vision, the overall reduction in cost for the employees this year was roughly $8,600 in savings to the district by remaining on the existing plan. So my question is, do you all have any additional questions based off of what we provided? We also sent the email out showing comparisons to different cities and what their general BO plan looked like compared to the districts.
Yeah, looking at the surrounding cities, like Roanoke, Westlake, the town, it looked like it had a better or equivalent plan. Is that your assessment?
Overall, we are right in the mix. It's all very different to try to base our benefits because of the amount of employees we have and the plans that the cities have. They qualify for different and sometimes better plans because of the amount of employees that they have in their organization. So generally, when you look at it, we are right in the same category as far as the individual deductibles. Family's a little bit different, but for the most part, I believe we are in that median point.
The last meeting, my whole thing was I just need to see what the exposure is, and the information that was handed out was good information as far as the policy breakdowns. What we're looking at is 3 different policies specifically to the platinum and the gold. Is that correct?
Correct.
And the information we were given were per employee. Well, that's not our total exposure because we have families or dependents involved in some. So what you gave us today was excellent information, so thank you very much, especially with the late notice. It has a breakdown, and this is the handout that he emailed. Everyone has it, right?
Yes.
Doug, do you have it?
No, I do not.
I emailed it.
Yeah, we emailed it to him.
Okay, it's in the email. I don't know if you can
Okay.
pull up your MUD email. But what it has is, we're looking at a total of 15 employees, and then it has a breakdown per the benefit package. As I mentioned before, there's a gold and a platinum specifically, and there's a buy-down process that they can go off of. Specifically, if they go with the platinum, an employee is about $1,088.50, and that is absorbed by the MUD. We pay all employees, vision, dental, medical, we pay their part. Now, the buy-down specifically deals with going from a platinum level down to a gold level, which is a little bit lower premium, and then adding their family, their spouse, or their kids. Is that a correct assessment?
Correct.
Okay. So the only difference in exposure is if there's more than an employee involved, as in the top section, there's an employee that had two, he opted to do the family plan. That was a 3265.50. So in that case, we would absorb the employee part, and then 50% of the...
Based off of the base plan.
Right, and the way, Stephen, correct me if I'm wrong, the way to get to that conclusion is you take the 3265.50 minus the 1088, you get a difference, you divide by 50%.
That's correct.
Two, and then you would add that back to the 1088, is that, and that comes up
Correct.
with the number. Is that right, Stephen?
That's correct.
I'm a wizard with math numbers. So that's what you're looking at in the bottom, where you have the 2177.80. And for the two people, it would be the 5248 annually, is that right?
For the two people on there, correct?
Right, okay. So the MUD, the total exposure on the MUD would be for 8 employees at 1088.50, and that would be times 12, and then plus the two people at 2177.52, 248. That's just the platinum level for a total of 10, and then you had one that opted out, correct?
Correct.
Okay. If I say something wrong, just throw something out there. Okay, the next is the buy-down plan. The buy-down works basically the same, except we actually reimburse the employee up to 1088.
There's no reimbursement, so essentially what you get is the same amount of credit towards your family out-of-pocket expenses as if you were on the platinum plan.
Okay, so we don't give them up to 1088.
So if you've got $2,177 worth of family expenses paid towards dependent health care coverage, that same dollar amount is provided to the employees.
Just a second, we're getting some noise here.
Working just fine.
Yeah. Okay, we're gonna, can you hear all that static, Doug?
Yes, I can hear.
Okay, it just went away, so we're good again. Okay, so the employees, would we pick up the 9/11/39? That's your watch, I think.
Yeah.
Okay. On the second plan, we would pick up the 9/11/39,
That's correct.
and then we
That's-
would pick up the difference, 50% of the difference of 2734.17 and the 9/11/39?
That's correct.
No, you pick up the difference on, you still get the 1088.50 as the
That's right.
original base, because you're still giving the benefit of the employee for going to the buy down with a cheaper plan for their family.
Right, that's what Stephen told me earlier, so when you said it was only 9/11, a little confused.
That's why if you look at family, it's still the same proportional share of the district for the 2177.
We switched, so originally you were talking about the district's monthly cost.
Just leave it. The district's monthly, per the policy, and correct me if I'm wrong, the personnel handbook, the district pays all 100% of the employee cost on medical, vision, dental, and on.
50% towards dependent coverage based off of the base plan selected by the Board of Directors, which is the Platinum Plan.
Well, we're not selecting that plan. The employees do the selection.
No, sir, we do not select it. This is the Board of Directors that select these plans. You have every year since I've ever been here.
I don't disagree with that, but you're saying we selected the Platinum plan.
Correct, as the base
We-
plan 2 years ago.
We selected 2 plans or 3 plans per the handout, the gold, the silver, and the platinum. They
Correct,
can
and-
buy down to either one of them.
Made the base plan for all employees the Platinum.
Yep.
That was selected 2 years ago.
Okay, so that's fine,
So
but,
let me back up. Last year, the board decided to make the Platinum the base plan. The year prior to that, we were on UHC, United Healthcare, and the base plan was $3,000 deductible.
correct.
And so the Platinum would have been a buy up, and the Silver plan would have been a buy down. But last year, the board directed us to make the base plan the Platinum, and so we left 2 buy down plans.
Yep.
The plan selection is not employees making that selection. We provide you the data, and the board determines what deductible plan cost you want to make.
Where
the
does it
base.
say on the selected plan, it says that the employees will be reimbursed 100% of the cost of their medical, dental, vision, the cost, not an escalated, okay, it's $1,088 if you get on the second plan.
I'm sorry, I don't understand the question. You have to forgive me.
Okay, the
Steve, do you
question-
understand the question?
So the cost is, so the easiest way to say this is the district will pay the same amount. If the employee goes to the buy down, it is a benefit for the employee to be able to have a cheaper coverage. So they're taking a higher deductible and a higher max out of pocket in order to have a little bit lower plan. So that's why if you look on the summary page here, you can actually see where I did the percentage, where the district covers 50%, which comes out to 75% total. That's 100% of the employee-only plan, plus the 50% difference between the two. As they buy down, it goes to 82% and 93%. We had this discussion about 3 years ago when we started to offer buy-down plans, and I believe Director Rose at the time was one that was big, but make sure we had a secondary plan or a buy-down plan to allow some of the families, especially for, field guys and the staff there, to have them a little bit cheaper plan. The district would pay a little bit higher proportion. But it still has to go off of a singular base. So the base plan in this particular situation is the Platinum plan. 2 years ago, our base plan was $1,500, I believe, but because we switched providers, the comparable provider that we had, which is Blue Cross Blue Shield, went to the Platinum, which is the $1,250 that's there now. Now, 3 years ago, we did have the 3,000 plan, and that was a discussion that we had. I believe, if I remember right, we talked about it was about $60,000 difference roughly, and it was chosen by the board to go ahead and move forward with that being the base plan. So when we do calculations, whether it's budgeting or whether it's for the total proportional share for the district, we have to go off a base plan.
Again, the handbook references, and I'm not going to make this a long discussion, I'm just asking the question, does the handbook say we'll pay 100% of the cost, the medical plan cost?
Yes, it covers employees' benefits, 100%.
Okay, so our cost of that plan, or the employee cost, is $911.39. So you already explained what it does. So that person gets $1,088 off their cost of the $911 plus the dependents, correct? That they get credited, instead of $911, they get credited $1,088. So we're basically reimbursing them more than their employee cost of the plan to offset the dependents that were added in at
Well,
a discounted rate.
We're always, the district's always providing more than just employee when they have dependents. So it's always been 50%. But with the buy-down plan, as we talked about on the phone, if you take away the $1,088 being the base and you move it down to the $911.39, you're de-incentivizing the employees to go to a buy-down plan. You're not giving them any benefit or any cheaper plan if you're still covering the same 50%. So basically, you would be offering a higher deductible, a higher max for the same coverage and the same out of pocket for them.
We're paying $1,088 no matter what plan they
Correct.
to the employee.
Correct.
So that and again, the definition of cost is what it costs, not, okay, it costs for an employee only $911.39, and we're paying $1,088 to that employee. That's not the cost of the plan. That's the cost that we're just saying the base plan is $1,088, so we're going to give you that. So you can buy down and save the difference between $1,088 and the $911 and use it to offset some of your dependents or family costs. That's the reality of it. Is that correct?
That's correct.
Okay. I mean, the difference is not monumental where, okay, what are we going to do? Let's sell the desk or something. So I'm not, saying that's not a good thing. I'm just saying that it says we'll pay 100% of the cost, but because of the buy-down plan, it's a little bit different. So if, that person that buys down is actually offsetting their family cost by a little bit of 1,088.
Right.
So how come the person in the top platinum plan that selects the family, they're not getting any credit?
Because that is the base plan.
Okay, I know what you're saying.
They're still getting this, the district is still paying the same amount of costs, whether we call it a flat 2177 cost, no matter what plan you go to, it's the employee proportion that changes. So the employee proportion goes from 1,088 out of pocket to 557 out of pocket.
So the
So it's
bottom
still the
line
same
is,
cost for the district, no matter what plan you choose.
the way it is now, because you're taking 1,088
Correct,
and
as a base
times it
plan.
by 14 employees, because one's opting out.
Correct.
Okay, so our exposure is 1,088 for the employee that's opting in a plan, 14. So 14 times 1,000.
Minimum, but you have family that we have to cover.
I'm not talking about
50%.
family yet. I'm just talking employee only.
Only, yes.
Is 1,088 times 14.
That's
That's our total exposure for employee benefit for an employee on these plans. Now, if they add the family, that's a little bit different. You add the 50%, like you said. So so everybody is on the same page. And that's the reason why I asked for this information, to get a clear understanding how you're coming up with the numbers when the other handout just had employees. I don't agree with that, we don't pay the cost, but it is what it is. So does everybody understand that? It's kind of like around the block. But I know you understand it because you've been down it.
Yeah. No, thank you for the additional work.
Yeah,
Put this together.
but you understand that even though the cost of the plan is $911.39, we're crediting the employee, the base plan price.
Yep.
Okay, just so you understand. The rest of it is pretty much in line with everybody else. I don't really have any problems on those. The vacation days, and that's part of the benefits package, so that's why I'm bringing up the vacation days. And correct me if I'm wrong, 11 holidays, 1 personal or floating day, right?
Correct.
10 sick days, correct? And then what else is there? The vacation days based on age.
Years
10
of service.
Sick
Yeah.
days?
Yeah, I mentioned 10 days and 6 days. And then the vacation days is 1 to 5 is like 2 weeks?
2 weeks.
And then 120 days or 3 weeks for
Correct.
10 and over. Is that correct?
Correct, 10 and over is 3 weeks.
Right, okay. So if you add those up, that's about, if a person has 10 years, not someone with 25 or something like Mike, I mean, he comes in when he wants to, right? So if you, but anyway, if you have it's about a month of the year that they can have vacation or whatever. You all right?
I just need a minute.
Sputter. We still maintain 3.
Okay. So, the sick days, and this is a question, and do we have required documentation if they're out X amount of days, or?
Yes.
And what, that's a medical thing, right?
It depends
Okay,
on what the
good.
situation is.
Good, okay. And the contribution, I asked you this question at the last meeting, and you said there is no max, but there's a 7% max of salary on the 2-to-1 match.
7% of our gross income is deducted for retirement fund.
Up
and
to 7%.
7% flat. 7% is deducted from our salaries for contributions to retirement, TCDRS, and the district matches those funds 2-to-1 after they become vested.
Right, so it's basically 7%. Yeah,
Ends up being 21% total if you look at it from a retirement perspective.
right, okay.
I think we've wandered off of the agenda.
No, we haven't, it's still the benefits package.
No, it's health employee, health and auxiliary benefits.
That's in the benefits. So that was my question on that.
Auxiliary benefits.
Okay. You all right now, Ben?
Yeah.
You have any questions, Bill?
Off a couple weeks ago, and every now and then it comes back.
Bill, you have any questions?
On On the life insurance, I do have a question.
Okay?
And clearly, this should have been taken care of back when we were doing the budget to work up these comparisons back in the early budget days. And so I don't know that anything can occur at this point. So my question is, I'm looking at the life insurance comparisons, the dental insurance comparisons, and the vision insurance comparisons. The district for life insurance pays 2 times the annual salary up to $100,000. And I imagine that everyone would get capped down on that at the $100,000. The town pays 2 times the salary up to $200,000. It would appear to me that we're not meeting the standard on the local turf. Looking at the dental insurance rate comparisons, we cover 100% and the town covers 100% of the employee, but for dependents, we cover 50% and the town covers 100%. Once again, I think the town is providing a better benefit there than we do. And then when it comes to vision insurance rate comparisons, once again, the employee's 100% for vision for both the town and the district, and the dependent, we pay 50% and the town pays 100%. I don't know that we can take any action on this at this point because as late as we are in the game, but I think this is something that seriously needs to be considered at the next budget meeting for next year. So if you tell me, because I don't think we have dollars, we have a certain budget we're running against, and I don't think we have a dollar amount from a provider to get any feeling on what would happen to the budget. So I don't think at this point I can take action, but it's a definite point that I want considered in the next budget.
And I would greatly appreciate any board members' concerns regarding benefits, salaries, compensations be provided to us prior to the budget process, so we're not scrambling at last minute trying to get information gathered and put together, and we can give you a good, clear package to review, understand, and we can use comparison cities and competitor cities to base your decision on. So that would be my request.
I think prior planning would pay off on this. We need to be, when we do the budget, need to in some areas get a little bit more detail than where we had been
Correct.
This year. Anyway,
In the medical and benefits package, I need to include something like this.
Now that I know that that's what's
Yeah.
going to be requested,
Rather
no one's
than throw
ever
a number
requested
out
that
there.
since I've been here, so I apologize that you didn't receive that before.
No big deal. I mean, you live and learn, and this is a step that we take to next year in the budget. We have what the current information is, how many people opted into certain programs and what our exposure is, and you add like 4 or 5% to it, whatever, and that's what your budget line is.
Typically, it's 15% because it can be a high swing, correct?
Yeah.
But I definitely think that we'll get a comprehensive review of our benefits and provide that prior to the budget conversations in June.
Yeah, but if you go to different cities, as what Lori sent out, there's some cities that make employees pay certain things.
Correct,
And
such
you have-
as
you have-
Flower Mound, they make the
Right.
employee pay 10%, but that cost for the employee is $10.
Right, right. And you have to
It's
take,
very
you're not going to get apples to apples on every plan. And some people have Aetna, Cigna, United Healthcare,
Right.
things of that. So, I mean, for someone to go through, that's what the person that gives us these quotes should be doing, not
They do.
our staff. Yeah, and I'm just saying. So, okay. Anything else, Bill?
no.
Ben?
I like the comparative data. It helps the conversation get started, and I think that conversation rightly should start during the budget process, so I agree with that.
Doug? You have anything?
Yes, I did appreciate the comparison study as well. I was disappointed that the water district pays a little less than the city does. But, that be as it may. My question is, the individual employee for the district, is their health care going up a little bit this year, or is it about the same, or?
It's actually going down a
How
little
does it
bit.
shake out?
It's actually going down a little bit.
Okay.
Costs.
The deductible is $1,250 versus $1,500, and, you know, it's a better plan than last year, is that correct?
It's the same plan as last year, but the overall cost for employees is going down.
Yep,
Oh, yeah,
same
You
plan,
changed
lower
the
cost.
$1,250 last year.
Correct.
That's right.
The plan
I
is
keep forgetting
not
that.
changing, but the overall cost for employees and current selections is going down a little bit.
And again-
$8,600 in savings on the,
Yeah, again, as Stephen mentioned to me earlier, we're kind of at a disadvantage because we only have 15 people.
Correct.
Where other entities have, you know, 200 or 300. And then we're also a special district, or considered a special district, so we're on that island too. So, all in all, okay. You have anything else, Doug?
No, thank you.
Okay, Bill? Ben?
Good.
Okay, I'll entertain a motion.
I can make the motion I made last week.
Well, I'll just make a motion today.
Okay. Move to approve the continuation of the employee medical benefits with Blue Cross Blue Shield and employee ancillary benefits with MetLife for the calendar year beginning January 1st, 2024 and ending December 31st, 2024, and also authorize the general manager to execute the necessary documents.
As presented to the board in this schedule, correct?
It's a continuation of,
Yeah, but you said per last year's plan, but as per the 2024, which went down.
124, yeah.
Just making it clear. Okay, second?
I'll second.
Okay, we have a motion by Director Rose, second by Vice President Brewster. All in favor, show of hands. Okay, I have everyone unanimous. Very good. Thank you very much for the information, especially last minute information. Okay, next we're going to go to agenda item 2. Consider an act to accept the resignation of Director Tracy Hunter, place 3, from the Board of Directors. As everyone knows, Tracy submitted her resignation effective on the 15th, is that right, Lori? Yeah, it was the 15th, that was correct. And then Emily, you stated that it technically is effective immediately, but we wait 8 days, is that right? You're muted. Emily, you're muted.
How many times have I been on Zoom? Whether the resignation is effective immediately or at a future date, a vacancy occurs on the date the resignation is accepted by the appropriate authority, which is you all, or on the 8th day after the date of receipt of the authority. by the
Okay.
authority.
So the 8th day was Thanksgiving Day, is that correct?
correct.
Okay, so we will take a vote on the agenda item to accept the resignation. Okay, I'll entertain a motion to consider an act to accept or the resignation of Director Tracy Hunter, place 3 from the Board of Directors.
Did you just make the motion?
Excuse me?
You're making the motion?
No, I'm asking for one. I'll make it. I make a motion that we accept the resignation of Director Tracy Hunter, place 3, from the Board of Directors. Do I have a second?
Second.
I have a second by Vice President Brewster. Any discussion? I see none. All in favor, show of hands. Okay, that's unanimous. Okay, moving on. Agenda 3, discussion and possible action on procedures for the appointment of new director to fill the vacancy of place 3. Do we have a process or plan of action?
So we provided you the process utilized the last time this situation occurred. And I believe what happened last time was the board advertised for vacancies and requested applications for those who were interested. I think that time frame was roughly 2 weeks, and then the board reconvened, reviewed applications in executive session, and then took action to appoint whom they so desired to serve on the board based off of the applications and the criteria. So we gave you the previous application for your review. That way, if you all wanted to change anything, add, take away, whatever that may be, you can certainly do so.
Okay, and from what I understand from an email, we have an applicant, Philip Schaffner, is that correct?
We received an email of someone showing interest, yes.
Okay. And so what, for discussion, what's the board's in favor of Mr. Rose?
I think we should follow the prior procedure, the timeline. If we're not going to have a meeting, if we have a meeting in December, I think, I know I'm not going to be here for the one that was originally scheduled 16th, and we were going to leave whether we were going to have a meeting in December to be determined at this meeting, if I remember correctly. So I'm basically working off of a January meeting, knowing that everybody's going to be into the holiday mode. When would be the projected January meeting? Do we have a date on that? Let me do a quick timeline here.
Looks like the 20th,
The 20th?
January 20th.
Okay, and if we process, if we go out, open this up for applications, we'd want to get those back so that they would be available for the meeting. So if you go a week prior to that, 20th, that'd be the 13th. So my thought process is we open up the application procedure, use all of the venues available for notification, and have the closeout date no later than close of business on the 13th.
The meeting would actually be on the 17th.
The meeting will be, oh, okay, well, that backs that up. Now, wait a minute, the 17th, knock off a week, 10th. So now we're into the 10th? Is the 10th a business day?
Yes.
Okay, so then we would have closeout no later than close of business on the 10th for submission. That allows time to put it together and put it on that agenda meeting and on that meeting's agenda, and then we can do the executive session and review the applications we have and go from there. And I say go
On
from
the
there.
17th of January.
On the 17th. Close, the applications would be due no later than close of business on the 10th,
January 10th.
January 10th. That
Can I
should give,
make
with the notifications,
Hold on, Emily's, go ahead, Emily.
Yeah, I just wanted to jump in about timing. You have to appoint this person no later than the 60th day after the date the vacancy occurred, which I understand happened on Thanksgiving Day, correct?
Yes.
Okay, so you have until January 22nd. If you don't do it by then there's other processes that kick in. So you want to do it by January 22nd to make it easy on yourself. That only gives you that meeting. If you don't come to a decision, with the majority of the board, you don't have a second meeting to consider it, because
Okay.
that January 17th meeting, you don't really have time to do anything, or even, I'm not sure you can even call a meeting before January 22nd.
Okay, so on January 17th, we can decide and appoint that day. Does the person have to be sworn in that day, before the
Yeah, you
22nd?
can. I'm just saying, if you all don't come to a decision with the majority of the board about who you should appoint, that you don't have another meeting to then take it up.
I don't think there'll be a problem with that.
You see what I'm saying? You
You don't know
left
who's
yourself
going to
with
apply?
And you
no
wouldn't,
buffer.
I don't think that you would have, you can appoint, but they wouldn't be sworn in until the February meeting. Is that correct?
Well, Emily,
Oh.
what about executing the bonds?
Yeah, you'd have to do all of that, so they probably wouldn't be sworn in then. You probably just appoint,
Until
but I'd have to
February.
look at all of that. But as long as they're appointed by the 22nd, you're okay.
Yeah. February,
Okay,
swearing in.
so I'm pretty confident that we'll be able to make a decision at at that meeting on the 17th.
What do you foresee coming up in a December or January meeting? Because then we're waiting 2 meetings technically. before
As
that
of
person.
right now, the only thing I'm waiting for is a proposal for wastewater system improvement repairs, point repairs. There's nothing other than that that I'm aware of. Or is there anything you all can think of?
January, we have an audit that needs to be adopted.
Right, that's what I was thinking too, the audit. So I'd prefer to have a person in place to go over the audit, if possible.
So then
That's
y'all
just
would,
my thoughts.
well, then y'all would have to determine what dates in December work best for you all.
Would,
But if you go with the thing at I was looking at the 13th. If I pull that calendar, let me get to the bottom of this page and get the calendar back up. No, I can't. It's not on this one. I think we were originally scheduled like the 16th or something. And I know I'm not going to be available that week,
It was the 20th.
the 20th. I'm not going to be available.
What about the week of the 13th? We could accept applications up to the close of business on the 12th, and we could have the regular scheduled meeting on the 13th and let you all review applications at that time.
That would be 12th. It's just going to be 2 weeks.
right.
That's correct, which is in line with what was done the last time. the
Will that
situation
allow you,
occurred.
my question is that going to allow adequate time to get the advertisements out?
So our advertisements are going to be a Facebook post, e-blast, and we should be able to send an email out to district residents
Okay,
of the vacancy.
okay.
So you can make the
You think-
13th?
You think that's 12 days? 12th would be, we're sitting here on the 28th, so you're looking at 2 weeks. Is that sufficient time?
Fine with me. I don't think we're going to have that many applicants, to be honest with you.
The end of business on the 12th. If we can get something sent out tomorrow, then by the end of business on the 12th would be 2 full weeks. The regular scheduled meeting could be set for the 13th, and you all could review applicants in executive session, and we can have an item on there for appointing.
Okay.
Someone to
It
fill
just
that
seems to me,
vacancy.
2 weeks just seems tight to me, but I'd prefer a touch bit longer, but
Wait,
here
so-
again, it gets into the December meeting.
So what meeting can you, the 13th?
Well, yeah, because like I said, I can't get into that. the
You're
20th,
available on the
16th.
13th, right?
Yeah.
Okay. Ben, you have anything?
I'm available.
Doug? 13th? You're retired by that time, aren't you?
Not quite, 2 weeks from there.
Okay. So you're good on the 13th? You're going to be in town?
Yes, sir. Yeah.
Okay, and I'm good too. So is the 13th okay?
Are you sure that's not too tight?
It's gonna be tight, but
That you can do it? Okay.
we'll just get. 'em
Okay,
all done.
let's do it because I prefer to have, whoever's going to take a 2-year term over, go through the audit and understand what's going on and stuff. Okay, let's do that. Do we have to make a motion on that or just, okay?
The verbiage on it, is everybody okay with the verbiage we had on the last one?
Yeah, as far as the
On
questions?
the application itself?
I like the application.
Yeah, I don't have any problem on it. Okay, so we're going to,
It says application continued on the back. Okay, is that just the,
The requirements.
okay, all right. I'm good.
okay, so we need to make a motion that, in fact, I'll make a motion. We will use the current process and application that the general manager has passed to us, and we will take applicants up until December 10th. Was that the date we said?
It was a 12.
It was the 12th, December
12th,
12th.
okay, December 12th. And then this board will meet on the 13th to review and take action on appointment.
Is that no later than close of business on the 12th?
Correct.
Okay.
Everybody understand the motion?
Yep.
Okay, any discussion, or you have anything, Doug?
No, I'll second that.
Okay. I made the motion, Secretary Treasurer Harper second. All in favor?
Do we have any discussion?
Unanimous.
Can you restate that motion? Sorry.
blah, 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 blah. No, it's to follow the process we had in the past using the general manager's application that was distributed to the directors, and to accept applications up to the end of business day on the 12th, and then the board will meet on the 13th to review the applicants in executive session and to take action. Sound right? Doug, you agree with that summary? You second it. You agree with that summary of the motion?
Yes.
Okay. Got it, Lori? Okay. And it passed, unanimous. Okay. Next one, discuss impossible action regarding appointment to fill. It's pretty much what the last one, so we're not going to do anything on that. And it is for a 2-year term ending May 2026, correct?
Yes.
Okay. So no action on 4. Does everybody agree? No problems?
Correct.
Doug, no problems with skipping 4? Okay. Items for future agenda. Obviously, we have the December 12th meeting, and the item of appointing or review applicants and taking action on appointment is one of the ones on there.
December 13th. Meeting's on 13th.
December 13th, I meant.
Correct.
Yeah, correct. Thank you. Okay. Anything else anyone want to put on there? Doug, you have anything?
No, I don't.
Okay. Set future meeting date, that's the 13th. And is the regular time 6:30, is that correct?
Correct.
Okay, Doug, 6:30 on the 13th?
Good. That's good. I got it down.
And that's it. We're going to adjourn at 4:57. Thank you, Emily. Thank you, Doug, for dialing in.